This is easily the 15th tube of tretinoin that I have used in the last 3 years. And let me tell you what it did for my skin. Hi, I'm Dr. Alpna Mohta, a board certified dermatologist, here to tell you why you should be using tretinoin. So I had always had oily, acne-prone skin. It was super sensitive and always stayed inflamed. Basically, anything under the sun, including the sun, would flare it up. I had one of those rare double whammy situations where my skin was suffering from both acne vulgaris as well as acne rosacea. I can't believe I'm saying this, but back then, the only skincare routine that I had was using a face wash. That's all. That's all. Because I used to think whatever I used, be it a moisturizer or a sunscreen, it would always break me out. Well, thank God I chose dermatology as my stream of study, and finally I was introduced to skincare's darling, also known as tretinoin. So let's start by understanding what tretinoin actually is. It is a vitamin A derivative, often referred to as a retinoid. There are so many research publications on tretinoin. It is one of the most widely studied topical anti-aging compound. It comes in various strengths and formulations. We have tretinoin creams, we have tretinoin gels, and currently we also have some tretinoin lotions. Usually the strengths of formulation can range anywhere between 0.025 to 0.1%. Now let's talk about the benefits of tretinoin. It's a powerful anti-acne agent. Unlike other antibiotics that are used for the treatment of acne, there is no resistance to tretinoin. It gradually clears the pores and reduces the inflammation in acne. It regulates the cell turnover. It is also used as a very powerful topical anti-aging modality. Now, unlike most other anti-aging creams out there, tretinoin reaches the deeper layers of the skin. That is, it reaches up to the dermis. It stimulates the synthesis of collagen. Of course, there is one downside to all of this. Tretinoin can also lead to exfoliation sometimes. Usually it goes away on its own within 3 to 4 weeks, or if you are rigorously using a moisturizer, the side effect can be reduced. It also evens out your skin tone. It reduces hyperpigmentation. There is also some research that says that it also minimizes the appearance of pores around your nose and chin area. Now let's talk about how should you use tretinoin. Of course, just like any other active that you're going to start for your skin, you have to start slowly. Start with using it just once a week at night. Use a lower strength and a gentler formulation. I would suggest to start with a 0.025% cream formulation once a week at night. Gradually build up your skin's tolerance, and you can reach up to 0.05 to even 0.1% over the course of next 6 to 7 months. If you are new to tretinoin, always follow the sandwich approach. First, apply a thin layer of moisturizer all over your face. Then take just a pea-sized amount of tretinoin and apply it all over your face. And again, apply another layer of moisturizer. Use it only at night time. It should never be used in the daytime. And for as long as you're using tretinoin at night, always practice strict sun protection in the morning. I would suggest you to use at least a sunscreen with SPF of 50 or higher. Repeat application every 3 hours. And just like any other skincare active, consistency is the key with seeing results from tretinoin. It might take you up to 3 to 6 months to see visible difference. Now let's talk about who cannot use tretinoin. Number 1, if you're pregnant or if you're breastfeeding, you absolutely should not use tretinoin at any cost because it is a known teratogenic. Number 2, people with extremely sensitive skin. Guys, if you have already reacted with other skincare actives like AHAs, BHAs, or even retinol, you should not start using tretinoin. I would rather suggest you to stick to a milder skincare active like niacinamide or maybe even ceramides. And of course, since it's not an over-the-counter drug, you need a physician or a dermatologist's prescription to start using tretinoin. So head over to your nearest healthcare provider to know whether tretinoin is right for you or not. So that's it from my side. If you like this video, please like, share and subscribe. With that, this is Dr. Alpna Mohta signing off.